India. Brain-dead person gives lungs to a COVID-19 patient in Asia's first such transplant, arms to a young woman. Both transplants successful.
Here's a summary of the article.
Chennai, Mumbai. When a 48-year-old man from Ghaziabad, whose lungs had been damaged due to COVID-19, was wheeled into a Chennai hospital on Friday, he had a slim chance of survival. They both had one man and his family to thank. The organs came from a 34-year-old man who was declared brain dead by doctors at Gleneagles Global Hospital in Chennai after intracerebral hemorrhage on Thursday. While Global Hospital's Chennai branch, where he died, retained the liver, the heart and lungs went to 2 patients in a different hospital, kidneys to 2 patients at Gem Hospital, skin to Sims and hands to Monica at Global Hospital in Mumbai. The cross-match between the donor and recipient came late in the evening, with the donated arms being flown to Mumbai in a special charter flight around 10:50 p.m. The organs were wheeled into the operation theatre around 2 a.m. on Friday and the transplant was declared complete around 5:30 p.m. Monica, a resident of Kurla in Mumbai, had lost her hands at the Ghatkopar station and on Friday, became the first in Mumbai to undergo a hand transplant. The family is now raising funds for the surgery and the long rehabilitation ahead. In Chennai, the 8-hour-long transplant surgery on the COVID patient with damaged lungs ended at 7 a.m. on Friday. 12 hours after surgery, the patient is able to do well without ECMO. His new lungs are healthy. He has no other comorbid conditions or illness. But he is still on a ventilator because he is weak. Recovery will take time as his chest muscles are weak now, said transplant pulmonologist Dr. Apar Jindal.
This post received a score of 37,000, with an upvote ratio of 95%. Here are the top comments in response to this article.
I'm still processing that arm transplants are possible.
Seems easy compared to lung transplants.
Yeah, first successful hand transplant 2000, first successful double-arm transplant 2008. First successful lung transplant 1983. In 1981 there was a successful heart plus lungs in the same transplant, but maybe that is a bit easier as you wouldn't have to reconnect them. Wiki refers to them separately. For anyone else curious.
Then there is that crazy doctor in Europe trying to do a head transplant.
I'm probably getting whooshed, but isn't that just a body transplant? It's an axe.
A procedure perfected by the dwarves of Middle-earth.
Sometimes they leave the axe embedded in their nervous system. Extra points if you wiggle the axe to make a point.
What a humanitarian and powerful decision from the family. In Portugal, if you are brain dead, you are automatically an organ donor. So your family doesn't have to give any authorization. But you can register in the non-donors national list if that's your will.
That is an interesting arrangement. Organ donation in India is not at all popular. Counselors and doctors at hospitals need to convince the family of the deceased into donation. Voluntarily registering for it is not common.
Here in Portugal things were like that. We had big problems with the lack of organs in hospitals. 20 years ago lawmakers cleverly turned the problem. You can voluntarily register yourself as a non-donor. If you don't do it, you are automatically a donor. From less than 8% of the population as organ donors, we have now more 96% of the population as organ donors. And organs are not only for Portuguese citizens. We send it to Spain and other countries if needed.
Does Portugal go as far as other countries and move you to the bottom of the transplant list if you have opted out of donating but need a transplant?
AFAIK Singapore did this and their organ donation registration went up dramatically.
LMAO, that's wild.
So HES gonna wake up one day, amputated and lungless.
This is how we get RoboCop.
Pretty sure brain dead means dead. Unless it's CCP for death camp prisoner.
Brain dead usually refers to no conscious or unconscious life. Just the blood is still flowing in the body so the tissue cells aren't dying.
The body is also usually kept alive by machines.
I imagine it has to mean that because if you were able to breathe on your own, then your brain is still functioning in some capacity.
One thing I wonder with arm transplants, is there a way to determine match? Like, can you take a set of pythons off a bodybuilder and put them on a small and skinny young kid?
This video was automatically created by Reddit to speech. The article and comments in this video were selected from Reddit according to their upvotes, and any paraphrasing was performed by smmry.com, without any human intervention.